Let's talk about the treatment of SLE. How do you treat a case of SLE? The SLE treatment depends on the stage of the disease or the severity of the disease, if there is organ involvement or not, and if the organ involvement is severe or not. So, for mild cases where you don't have severe organ involvement, you can just prescribe hydroxychloroquine. That is kind of like the first line drug for SLE. And along with hydroxychloroquine, you can also use low dose prednisolone, such as zero point 0.3 to zero point 0.5 milligram per day. That is your treatment for mild SLE. And if there are joint symptoms, fever, headache, then you can prescribe NSAIDs. For moderate SLE, along with those, you have to, along with hydroxychloroquine, you have to increase the dose of steroid to higher doses, like 0.5 to 1 milligram per kg. And in patients with severe SLE, where you have involvement of the kidney, involvement of the brain, etc., you have to give initially pulse methylprednisolone, and then you have to give multiple cycles of cyclophosphamide, usually 6 cycles every 28 days. And along with those, you continue steroid for some time, and then you switch to steroid sparing agent. So that is the basic treatment of SLE. Those are the specific treatment, and you also give some general advice, such as you educate the patient, you counsel about the disease, you ask her or him to avoid going out too much, so avoid sunlight, and you also prescribe sunscreen. You ask them to put on sunscreen whenever they go out, and you try to control any comorbid risk factors such as diabetes, hypertension, because those patients have an increased risk of cardiovascular mortality. So that's the treatment. Specific and general. Specific treatment in mild cases, hydroxychloroquine, NSAIDs, and low dose steroid. In moderate cases, the steroid dose can be increased, and you can also use steroid sparing agents. In severe cases, you use pulse methylprednisolone, and you also use pulses of cyclophosphamide, 6 cycles of cyclophosphamide, especially whenever there is kidney involvement or CNS lupus. Okay, so those are the treatments of patient with SLE.